welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, we are super excited to have you here because we bring exciting conversations with leaders who are painstakingly shaping the future of healthcare. We also happen to be incredibly passionate about innovation adoption within healthcare, leadership, and providing more access. And if it's your first time tuning in, let me just tell you a little bit about what we're doing here. So we're a healthcare innovation company. We're focused on bringing stories of innovation within healthcare to life. And our aim is really highlighting real people that are truly innovating within our space and giving them just a platform to share their stories with the world. And we've got an amazing jam-packed year planned with new content and amazing interviews. And if you haven't had the opportunity to check out any of the historical ones, make sure you hit the subscribe button now so that content comes right to you. Today, I'm extremely delighted to welcome Emeka Oguh, an accomplished entrepreneur and experienced leader. Emeka currently serves as the CEO of PeopleJoy, a revolutionary initiative that partners with employers to formulate strategies for student debt management and relief. Emeka is not a newcomer to innovation and leadership. In all of his roles, Emeka has exhibited an uncanny ability to drive product development, execute go-market strategies, and managing highly collaborative and high-functioning teams. And a lot of his work is focused on important societal issues, such as wealth gaps between different races and genders, and as well as promoting mental and financial health. He's made significant strides in addressing these very important issues, which we'll talk about today. So Emeka, welcome. We're really thrilled to have you with us today.
Michael, thank you for having me. Happy to be here.
Awesome. So let's dive into a little bit of your history, because I think you've done some really interesting tours of duty in terms of coming into your existing role. Would you maybe mind sharing a little bit with our folks about you and your story? You know, who is Emeka?
Absolutely, Michael. And I'll first say to your audience, and hopefully I don't disappoint anybody, full disclosure, I'm not a healthcare guy. I was one of those folks who never really liked the sight of blood growing up and whatnot. And it's funny because my father worked in a hospital for 30 years in Newark. My sister's a pharmacist. I have an uncle who's a pharmacist. I'm married to a physician. And so I'm healthcare adjacent. And I feel like it's one of those industries where I've always told myself, hey, I've avoided, but now we're in a position where 90% of our customers are healthcare and healthcare service companies. So I think the universe spoke for me and ultimately said that, you know, healthcare is where you're going to be. But like you mentioned, my path here was a little circuitous. I have a degree in electrical engineering from Rutgers University. Started my career on Wall Street at Merrill Lynch in our financials and our investment management and guidance group, where I helped oversee $315 billion of assets under management. Started Merrill Lynch, ended Bank of America because this was during the Great Recession, where, you know, with the mortgage crisis. And I think that was really my first sort of realization of the impact or the impact of a lack of financial literacy. Having both seen working at a 93-year-old institution, very much involved in the mortgage crisis, and just seeing the impact on the economy, as well as personally within my own family. You know, I had an uncle who you know, taught in the local school systems in New Jersey for 25 plus years, had a 2-bedroom apartment with a family of 4. Finally got his dream home that you know, got the American dream, and had to abandon that home because of adjustable rate mortgages and not being able to afford that payment when it adjusted, or being able to refinance. And so it really showed me that impact on or lack of financial literacy has on individuals, and started my path to what is now PeopleJoy. Went to business school and worked a couple years in various startups, and again, in product roles, helping build companies, some that I've helped other entrepreneurs build, and some that I built on my own. And started PeopleJoy really after I sold my previous business, because I wanted to do something that was fulfilling, and get back to my roots of how do we help the people with financial wealth, everyday people. When I was at Merrill Lynch, I was working on ultra high net worth individual accounts, so helping people, with $20 minimum net worth get wealthier. Nothing wrong with that, but not a product that I could sell to my parents, my siblings and whatnot, and my friends. And so I wanted to make sure that we pursued programs and services that helped remove the roadblocks to financial freedom, student debt being one of them. And so when I looked at PeopleJoy, it was out of a personal challenge that I faced and my wife was facing. So, as I mentioned, my wife is a physician. She's an anesthesiologist, specifically a pediatric anesthesiologist. And between business school for me and medical school for her, we had over $400,000 in student loans. And we had moved down to Philly around the time I sold my company. And I remember, when we were going to buy a home, the bank said, take your wife off of the loan because her debt to income ratio is too high. Even though she's going to be a physician, she was in residency at the time. We had to take her off the loan. And so, if I hadn't had the means to purchase our home, we would have missed out on that ability to buy a home and the appreciation that came within the following years because of that. You can imagine that story is being played out throughout the United States of America. The delaying saving for retirement because of student debt, because you're putting money towards student debt. You're not. Studies have shown that Americans are less likely to save for retirement or put in. They'll save at a lower amount when they have student loans than those who don't. And so, again, coming from that financial services investment management background, where I was told about the impact of compounding interest, and every year that you wait or delay to save or underinvest in your retirement is really 1 year that you're avoiding. You're not taking advantage of that compounding interest with the S&P growing at an average rate of 9% a year. And so when I started PeopleJoy, it was really with this mindset of how do we work with employers to provide solutions that provide financial wellness, but at the same time attract and retain talent for that employer. And the good news is that what we discovered is that there are a lot of public-private policy programs in place, Michael, that are designed to do just that. That a lot of health systems just aren't aware of. One of the biggest ones that we discovered.
Why aren't they aware of it? I mean, is it? Yeah. Why? Why don't they know about this?
That's a great question. So the reason is, again, some of the public-private policy programs are at the individual level. And so it's not really the responsibility. It wasn't the responsibility of the employer to know, even though that policy actually impacted them. So the biggest one, we do a lot of work with not only health systems, but state and local governments, is the Public Service Loan Forgiveness Program. The PSLF program was enacted in 2007 during the Bush administration. They saw there was going to be a shortage of nurses, of frontline healthcare workers, of primary care physicians, of teachers, and so on and so forth. They also knew that a lot of employees going into these positions weren't necessarily going to make a lot of money, but they were going to make an impact. Doesn't mean they didn't want to make a living, but really it was impact driven first. And so the promise was, we know that you're coming into these positions that don't necessarily pay the best. And we know that there's opportunities to work in the private sector and get paid a lot more, sort of regular C corps. And so our promise to you is this: if you work for any of these organizations, any 501c3, which again, most health systems in the country are, about 5,200 are, we're going to forgive your student loans tax-free. The promise is that you have to work at a 501c3, any 501c3, a series of 501c3s for a period of 10 years. We're going to forgive your loans tax-free, no questions asked. So this was enacted in 2007. The first sort of range of loans really then became due in 2017, 2018. And the forgiveness rates during the last few years have been abysmal, somewhere in the range of 99% rejection rates. And that had to do with everything from really employees, borrowers not understanding the requirements of those loans. And I can go into the sort of the nuances, but essentially borrowers lost faith in the program. they no longer believe that the PSLF program would give them loan forgiveness. And if I don't believe that the program is going to give me loan forgiveness, what
Yeah.
incentive do I have to remain working for a not-for-profit? And so we went to nonprofit employers, to hospitals and health systems, and said, look, your employees are sitting on tens of millions of dollars of loan forgiveness. There's a 99% chance they don't get it. You don't know about this because, again, it's a direct to borrower sort of program, but you're incentivized for them to get it. So if you provide them with solutions to get this forgiveness, not only do they get more money in their pockets and they're able to buy the homes to save for retirement, but you get better retention. And we've seen that play out in a lot of different health systems, by employers really helping their employees take advantage of it. I look at it no different than, imagine if your employer were to say, Michael, I'm going to give you a tax preparer for free, right? So instead of you going out and hiring your own tax preparer at the end of the year, you get a courtesy tax advisor through our company. So we work as student loan advisors provided by the employer to really help the employee tap into these public service loan forgiveness programs.
So I mean, you mentioned that 90% of your customers are healthcare. How big is this problem? Meaning, on average, a medical professional that is working, like, how much student loan debt are they typically saddled with?
Yeah, within our the organization that we work with, we see ranges anywhere from 40,000 to $200,000 of student debt. The average being around 75,000, and we typically see income ratios sort of in line. So for the average uh, student loan debt of 75,000, we're seeing average incomes of around 75K. Now, obviously it skews, right? You have, you look within the health system, you have everything from environmental services staff all the way up to surgeons. So the salaries skew, but we're typically seeing debt to income ratios in that 1-to-1 at best. In some cases, in that 2-to-1 or 3-to-1, where you've got individuals who have 3 times the amount of debt relative to their salary. And that story plays out again and again. And so when you look at the average loan forgiveness, we're seeing it's in that $40,000 to $150,000 range. This year alone, into 2023, we've helped hospital employees receive over $23 million in loan forgiveness by helping them navigate through the public service loan forgiveness program.
23 million.
23
Amazing.
million.
Amazing. So you mentioned earlier in the conversation that you're not a healthcare guy, and I'm going to convince you that you are. And here's the thing. So outside of the four walls of a hospital, health is impacted in a wide variety of ways. And money is one of them. I would venture to say that when someone is saddled with $75,000 worth of debt, that has an impact on their health. Do you agree?
Absolutely, it has, and we see it play out time and time again. It has an impact on their health. It has an impact on their stress level. When you're navigating the public service loan forgiveness program, or just calling the federal servicer in general, again, we're talking about 46 million borrowers. The just sort of quick backstory: student loan payments have been suspended for the last 3 years. Just went into effect, back into effect this month. The wait times on these calls can be 3 hours. And let me tell you, Michael, they're not calling when they're at home at 6 p.m. making meatloaf for their kids. They're calling while they're at work. So we're also talking about lost productivity. But even more importantly, I think what's more disturbing, what we're seeing, is that it's impacting the choices that they're making when they're coming out of med school, right? When they're deciding between, hey, do I become a primary care physician versus taking a specialty? It's impacting where in the United States they work. So we're seeing, a shortage of for example, Black and brown healthcare workers in underserved communities. We all know, when you look at the social determinants of health, that individuals tend to want to work with healthcare givers that look like them. And so if there's a lack of folks that look like you in an area, you're less likely to go out and seek care. And so we're not only seeing an impact on their own health and wellness, but because there's a lack of diverse healthcare workers and frontline workers in underserved communities, it's impacting and spilling out into the community at large.
Yeah.
Most hospitals and health systems are the anchor institutions in the city, right? Like in Philadelphia, we've got Penn Medicine, we've got CHOP, you've got Drexel, you've got Temple. Like these are the anchor institutions. If they lay off employees or like there's a local recession, right? Because there's so many companies and systems tied into that. And if they're struggling to attract and retain talent, it's also impacting the health and welfare of the communities that they serve.
Yeah, absolutely. I mean, you mentioned it, the cultural congruence. People want to go and be treated, by someone that they feel comfortable with. And if they look like them, talk like them,
Correct.
there's a greater propensity for them to actually go in and opt in for those services.
Absolutely.
Along the same lines, when it comes to sort of how you guys are innovating, can you maybe talk a little bit about how you're doing this differently? And you mentioned someone having to do this on their own. To me, what it sounds like is that your team is like Sherpas, a team of Sherpas that are guiding people up this Mount Everest of debt, and they're helping them get to that top of that summit and inevitably getting rid of that debt. And that absolutely has a major impact on someone's health. You can help alleviate the burden of not having to sort of pay back hundreds of thousands of dollars in debt. I mean, that is a mortgage in many cases, people that to
Right.
a house that they'll never own. So yeah, I hate to tell you, you're a healthcare guy.
I think you have a very solid and convincing argument, and I like to say we help the people that help the people, and so when you look at we're looking at healthcare innovation from a different lens of there's obviously a lot of healthcare innovation and services and things towards people in need of care, and how do we get tests faster, and how do we provide more transparency around costs and whatnot. But at the end of the day, all these services need to be provided by caregivers. And so, who's taking care of the caregivers? Who's watching out for them and making sure that their needs are served? And that's the side of the healthcare innovation lens that we play, is making sure that your employees are engaged, fully engaged, want to be there, and want to be are coming to work and bringing their best selves to work. Because again, we all, you mentioned earlier, we all know what it's like to be financially stressed and not being present, fully present at work. And very risky place to not be present at work. If you work in a health system, you obviously want to make sure that the people, the caregivers, and everybody really within the health system are fully engaged. In terms of innovation, you mentioned Sherpas. I like to say we're Sherpas with iPads and MacBooks. So we've essentially, what we've done on the PSLF side of the business is, I call it Intuit for student loans. So what Intuit did was it took 80,000 pages of tax code and built if then else statements around it. And so you go into it, you upload your W-2, answer a few questions. It'll tell you, Michael, if you're eligible for a standard or itemized deductions. You can, what percentage of your time did you use your card? It's sort of on work, and it'll answer these questions and give you a really detailed um, uh, if you're lucky, a tax refund. And then if you have questions, you can get on the phone and talk to a licensed CPA, and they'll walk through what the system did for you and help guide you the rest of the way and help you submit your forms. We've built something very similar in that we've taken 10,000 pages of federal student loan law, and then we guide individuals through that process and program. And then if they have questions, they can talk to a student loan coach to help get them to the finish line. So we're technology enabled for sure. That's how we scale. It's making sure that we're efficient and also affordable for employers that work with us. And so again, as I mentioned, that is a big public-private policy program that we work with. Another one that we work with is Section 127, which of the tax code, which says that employers are able to give up to $5,250 towards tuition reimbursement or upskilling their workforce, which is very important, especially with a lot of healthcare organizations looking at how do we upskill our workforce, how do we turn our hourly wage workers to salaried employees. And so Section 127 allows you as an employer to give up to $5,250 towards tuition reimbursement or towards student loan repayment assistance, right? So you
Mm.
can also, maybe for your employees that aren't going back to school, but have student debt, you as an employer can make a matching contribution to their student loans. And some of the innovations we do there, besides providing the technology rails for employers to make that contribution and really being a third-party administrator to make sure they cross their T's and dot their I's so they're not getting a visit by the IRS at the end of the year, is really helping them structure it in terms of what the size of the contribution should be, Should it be an overpayment? Should it be part of the employee's minimum monthly payment? How can we leverage your employer contribution and take advantage of public service loan forgiveness? So you're not, because again, you want to take the full advantage of the 10 years that an employee needs for PSLF, right? So if that loan gets paid off in 6 years, that's great, but there's less of a hook necessarily to keep them there for the full 10 years. And so we structure it in a way where an employer can maximize the retention, but at the same time, reduce the out-of-pocket expense that an employee will pay towards paying off their student loan. So that's just an example.
That kind of answered into a little bit, is the employee, or they're still needing to pay their monthly amount. So in essence, you're saying that monthly amount, depending on how big the loan is, that will make a dent in the initial out-of-pocket that employee needs to make towards that monthly payment.
Right. Exactly. And so the way we would structure it is if an employer is making let's say, Michael, you're making your payment and it's $500 a month, right? Your employer is making a matching contribution that of let's say $100. So now you can there's two ways you can do it. You can say, I'm going to give $600 a month to pay off my student loan. Or the way we would structure it if you're a nonprofit employer is, let's look at reducing that employee's monthly payment. Maybe we reduce it to $100 a month, right? And now let's use your contribution to cover their payment. So now, as long as they work for you, they're not making any out-of-pocket payments. Why would they leave, right? I'm getting my loans paid by my employer, and in 10 years, whatever's remaining is going to get forgiven tax-free. And what we've seen is that when employers are implementing both strategies, PSLF at a minimum, but PSLF and SLRA, student loan repayment assistance, not only we're seeing loan forgiveness and employees paying less out of pocket, we're seeing improved retention. And so among our engaged employees, meaning the people that we work with, when we compare their turnover rates relative to the general population, we've seen differentials as high as 50%. Like, I'm not making this up. Over a year period, we've seen differentials as high as 50%.
And everything's equal and the same, barring that one factor.
Correct. Now, are there other benefits that the employer offers? Absolutely. Like, is the employer a great place to work? Yes. We're not a solution for horrible bosses, right? Like, we're not, I don't know too many things that can solve for that. So all things being considered, this is a great place to work. Employees feel motivated. They feel that there's career pathways and all of that. So I'm not, we're by no means taking credit for any of that, but all things being considered, great place to work, great environment, nonprofit, and you offer these perks. Why would they leave? Why would they go to another nonprofit? They're going to stay with you, right? And so that's what we've seen in terms of those improvements, and part of it goes towards that loan forgiveness being a golden handcuff. So when I worked in Wall Street, we got our bonuses in April of the following year. There was no turnover in January, February, March, because if you left, you would lose your bonus, right? Why would you do that? I look at the PSLF program as that golden handcuff for the nonprofit employees. It's not uncommon for a nurse or a frontline worker or even a physician to say, I'm going to get $80,000, $90,000, $110,000 of loan forgiveness in 2 years or 3 years. So I'm going to sit tight with my current employer until that happens. They're starting to look at it as part of total comp, which is to the advantage of the employer, because that's the $110,000 of total comp that's paid for by Uncle Sam. That's paid for by the Department of Education. It's not coming out of your pocket as an employer. And so what we're trying to really help employers to hone in on is really tap into these public-private policy programs, because this is free money from the government that's tied to your employer's retention. And the more you can make them aware of that and utilize that to your advantage, it's much more cost effective than giving that employee, a $100K bonus or $150,000 bonus to retain them.
So let's talk about for a second. I mean, I get it. You're innovative. You're doing some pretty incredible things. The results are the results. What is getting in the way of people saying, Emeka, we love this. We want to use this. Why wouldn't someone want to do this?
Yeah, that's a great question, and I think we are starting to see a lot more, interest in our services and our solutions. Just again, based off of our track record, so that 23 million that I mentioned to you this year, For us personally, a lot of our business is driven by referrals. So, we don't have a huge marketing budget. We're not on billboards or anything like that. So a lot of how people know about us is referrals from existing clients. And so we've been fortunate to be able to grow organically, and we do right by our clients, and they do right by us by referring us new business. Um, but I would say in general, again, when you're looking at benefits, that it's just there's always a degree of it takes time. It takes time for hospitals and health systems to make these decisions when it comes to looking at these sorts of benefits. There's obviously a cost associated with the work that we do and the amount of labor that goes into it. We're obviously dealing with a time with health systems are not always cash flow positive, and so sometimes that delays in making decisions. In the short term. So I would say that, but I would say in general, we've definitely seen an uptick in health systems adopting solutions like ours. If not PeopleJoy, they could be competitors of ours, right? But we've definitely seen an uptick in the last couple years of employers, one, recognizing this, right? There was a time 2 or 3 years ago, Michael, what I would say PSLF, and they didn't know what I was talking about. Right? They had no idea about this program. And so or we had employees that we would ask them at a health system, do you work for a nonprofit? And they would say no. They didn't even realize that they worked for a nonprofit. So I think the awareness gap has shrunk a little bit. There's still some there, but it's not as big as it was a few years ago. And employers are starting to take notice, especially CHROs, and especially now that we have the data to back it up. When you're dealing with a 40, 50,000 employee company, there's a lot of different benefits coming at you. Everybody's saying the same thing: we can attract and retain talent. And so the only way to really sit through that noise is to have data. And so now that we're having those proof points that show that, look, we're saving money and it's retaining people, and we're getting testimonials like we tell HR a lot of times this is one of the few benefits that they're going to actually reach back out to you and say thank you. And we're letting them know this is your company. It's not uncommon for somebody to work with our team and say, I paid somebody off the street $1,500, $2,000 to do this for me, and then I paid them another 2,000 to do this for my spouse, and I never heard back from anybody. And my employer is offering this at no cost. This is amazing, right? And so I think as time goes on, we're going to
Well,
start to see a lot
give
more.
us more of those
Yeah,
stories. I mean, give us more of those sound bites, because I think to me, if there's anyone else that's tuning in on this, is that they would consider taking those sound bites and bringing them to their leadership. Um, yeah, give us some sound bites. What are some of the things that are
yeah,
coming from some of the benefiters of this?
yeah. I mean, from the employers, it's really looking at us as a trusted partner to offer their solutions to help their employees because they know that it's a significant financial stressor. They're the ones who are getting inundated with questions from their employees about student debt and student debt solutions, and from the actual employees. And I can send you. I wish we had time. I can play you some because we actually have video recordings. We do a lot of folks that are willing to give testimonials
Yes.
about what we do and what we offer. We actually had one employee. She got her loans forgiven on her birthday, right? And so she actually went on LinkedIn, unsolicited, went on LinkedIn and thanked us, thanked her employer, and just this is the best benefit ever. This is the best birthday gift ever, getting loan forgiveness. We have another employee who said, I now feel comfortable. He was 10 years away from retirement, right? A lot of people assume that student debt is a Gen Z or a millennial problem. The average age on our platform is early 40s. We have parent plus loans and folks who are carrying, debt for grandchildren even. And she was just so grateful because she had tried and failed so many times. And having us and our guidance to do that work, it's not just about submitting the forms; it's making sure that you're in the right repayment plan, knowing how to read these rejection letters and how to navigate that. Just gratitude. I mean, really, just the level of excitement. We had one story where a woman, she was experiencing fertility issues. And so her and her husband had to take out loans for their fertility issues. And she said, if I can get my student debt forgiven, that frees up the debt that am taking out to start my family. And we were able to get her debt forgiven. We're starting
Wow.
families. We're starting families with debt forgiveness,
You're a
right? Like,
healthcare guy. Come on. Come
yeah,
on. You're a healthcare guy.
it's and so those stories are what keeps our team going because it's look, it can be a tough job to really provide this level of service and support. But when we get folks to the finish line, the happiness, the joy that the people receive. Okay, people joy. You start now seeing why we got to give the name that we have
Yes.
because it's
Yes.
about that end goal of financial freedom of being debt free. And so, I mean, the list goes on of just the stories that we've helped people with, the impact, and being able to then take those free savings and put it towards retirement, put it towards starting a family, put it towards buying a home, put it towards a wedding. Just that relief. People have told us they haven't been this happy since their first child was born, right? And I look, the personal story, we're part of that journey too, right? My wife still has 250,000 in student loans. We're 4 years away. We're waiting for our own story of getting forgiveness.
Yes.
And so a lot of our employees we're dealing with it ourselves. So we're coming from it from a place of empathy and understanding because we're going through it as well. And so that was really important for me, was to make sure when I'm building a product that I've in service that I myself have dealt with and can deal with it, and we bring people that are authentic to it and can deal with it because and can help employees because they've dealt with it as well. So those are some of the examples that we've seen. It's really about when that debt's forgiven, and then we also give webinars, live webinars. Typically, it's an hour-long recording, a student on one-on-one webinar, and just to be able to see. I like educating people. I like pulling the curtain back and helping people see here's how this really works, and
Yeah.
see their eyes open and say, "Oh my gosh, I didn't know that." Like that is just a drug that I'm addicted to, and just being able to demystify and explain and help people see this is how to actually navigate this thing. And so, that's we do that on a daily basis by helping people understand a really niche but complex part of the federal government's public-private policy programs and helping them navigate through that.
So let's just say we kind of wave a magic wand on PeopleJoy on the situation. We're talking a year from now. What is the ideal state of PeopleJoy look like in a year from
Yeah,
now?
so great question. So we want to really be the go-to provider of 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 high tech, high quality uh, administration of public-private policy programs. And so where I see us a year from now is, really in major hospitals across every state in the United States, also working with state and local governments. So state employees, again, states and health systems tend to be the largest employers, in most areas, and tend to be the recipients of some of the largest public-private policy programs. And again, are the stewards. They're the frontline individuals making sure that the
Right.
government runs, the city runs, and the trains run on time and everything in between. And it really has become our mission to help the people that help the people. And so, we have really big goals of, we want to be in multiple states. We want to start working with different states at the state level. And that includes health systems that fall within the states and everything in between. And really being that additional resource that helps attract and retain talent. And so our goal at the end of this year is end of next year is, we want to be in at least 15 states. We want to be in at least 70 hospitals, and we want to be able to show that proof that, hey, we've been able to retain talent. Like, this not only is helping put money back in your employees' pockets, we know that part, right? We know we're going to do that part because those are federal programs. But more importantly, this has led to better outcomes, better retention within those communities. Another thing I want to pinpoint, the DE&I component of this, I didn't really mention that, but when you look at student debt, 2/3 of it are owed by women and minorities. And so when companies are looking at how do you address the gender wealth gap, especially health systems where it tends to be 90% female to 10%
Yes.
male on average, student debt is one such way because it's going to remove those roadblocks that are preventing the disadvantaged communities from saving for retirement. Same thing with Black and Brown employees, they're coming into the workforce with twice the debt of the national average. So it's a benefit that you're going to offer to all your employees, but know that statistically, the folks who carry the most debt tend to, skew towards women and minorities, and so they're going to be most impacted by these public-private policy programs.
This isn't a job for you, Emeka.
No,
This is a calling. This is
it.
your passion is spewing out, and I love it because
Thank you.
people are attracted to passion. It's one thing to just sit here and hey, look how we're innovative. But like this is serious business. I mean, you're talking
Yeah,
about the lives and well-being of people, the people that
yep,
help the people. I love how you said that. The people that help the people.
yeah. No, thank
How
you,
do
Michael. I
we
appreciate that.
how do how do we follow your work? How do we follow the journey of PeopleJoy? Maybe just kind of give a little commercial where people can kind of get more information, get more
Absolutely.
stuff on PeopleJoy.
Yeah, definitely follow me on LinkedIn. I post a lot of our success stories and just the mission component of what we do on LinkedIn. My first name Emeka, Emeka, last name Oguh. You can also check out our website www.peoplejoy.com.
Amazing. And then for our community, I like to ask, what is it that we can do to support you? How can we best support you? And then what is the one ask that you have of our community?
Yeah, appreciate that. And I think, yeah, just if this is something that you feel your employees can benefit from, definitely, feel free to reach out to us. Even if you're just in an evaluation stage, we'd love to have a conversation and share some of our thoughts, some of our case studies and testimonials, and just to give you a sense of what it looks like. And I think just in general, I mean, you said healthcare innovation. So I think the folks who are your audience are already forward thinking and willing to take risk. Obviously it takes time to evangelize that and sort of promote that across the organization. So I'll just say stay patient in terms of doing that, and really make sure you talk to your thought leaders and help them see the upside of taking that risk. Right. When we first started, this looked risky to a lot of employers because
How
we
is it
were a young
risky?
company.
How is it risky in the sense that you're backing by government
Right.
programs? So I guess
Yeah.
what's the duration of time? And I know we're kind of running on time here, but like, what is the duration of time that it takes for you to be able to come back with data? I mean, you mentioned 10
Right.
years of that, but I mean, you guys aren't 10 years old just yet, but how do you kind of
Right.
leverage that?
Yeah, yeah. So great question. So I would say I'd just answer the risk point. The first risk point is just from a vendor risk standpoint, right? So when you look at
Yeah.
healthcare innovation, most vendors tend to be on the younger side when it comes to innovation. And so there's always that risk of you never get fired for hiring IBM. And so I think um, helping employers see, some of that just gets evolved with time. We were launched in 2016, right? So we're, what's that, 7, 8 years in the game now. So that's sort of as you get older and people realize that you're still here as a company, that sort of addresses itself. But how we measure success on the short term is, like you said, yeah, it is a 10-year program, but you're going to have some individuals who've already completed their 10 years, and so it's just a matter of crossing T's and dotting the I's to get forgiveness. You have some folks who just entered the workforce, they're 10 years away. Most people are going to be somewhere in between that, sort of 3 to 8 years out. And so the forgiveness piece is it's pretty much who got forgiveness this year, who didn't. But how we measure retention is typically we're looking at a 12 to 18-month period where we're then going to look back and say, okay, how many people joined us or were part of this program, let's say 12 months ago, and how many people are still employed with the organization within that subset today, right? And so what's that turnover rate look like? And then comparing that to the broader employer subset. Obviously, those numbers are going to evolve and change over time, but those are the key metrics that we're measuring on is attrition and forgiveness from a hard data perspective. And then from soft data, we have customer satisfaction scores that are typically 4.98 out of 5. Every time an employee has a touch base with one of our folks, we send out a survey asking for feedback. We share that with employers as well because that's more the qualitative feedback. How did they feel? How did they feel about this program? Did they feel less stressed? Did they feel more relief? And those are some of the data points that we share with employers typically on a quarterly basis so they can get a sense of what is this that I'm dealing with. We also share utilization rates because we want to make sure that we're really big on making sure that I didn't want this to be a benefit that, hey, you pay me money and nobody uses it and I get paid if nobody uses it. Like we're not that. One of the unique things about what we do is that we actually have utilization guarantees where we say, look, if this doesn't hit a certain amount of money, we actually will reduce our contract the following year. Like that's how we put our money on the line when it comes to um, utilization. We want to make sure that people are using this because if they're not, then like you said about the mission piece, then there's no fun in it for me if people aren't using it. And so we work with the employers to make sure that utilization rates are good and that this thing is overutilized and oversubscribed versus where they start to get the economies of scale because a lot more people than we initially
Yeah,
anticipated are signing up for the program.
amazing. Well, Emeka, I really appreciate you coming on. And for those that have tuned in, if you found the content helpful for you today, would you mind sharing it on social media? Just even commenting it and liking it. That always helps. So if you want to hit the subscribe, smash the like button, comment on it, especially with your network. I'm grateful, especially when we're trying to make differences here and helping people that are helping the people. So Emeka, I'm looking forward to having you come back on again at some point, and just learning more about the journey. So please stay the course, and I'm looking forward to our next discussion.
Thank you, Michael. Really appreciate being on your show today. Really thank you for having me. I had a great time and looking forward to hopefully being on again at some point.
My pleasure.